So they feed on glucose. Now the other thing they can feed on is yeast. Now that's so specific to fungi. They feed on what you call yeast. Now listen to this. Sugar, wherever sugar is, should not be close to a cancer cell. Are we together? Simply because that is their food. Now let me take you back to something. In wood management, we can use honey. Now honey iko na property moja, siko na sukari mingi. Now honey inafanyanga kwa one way. Honey usually attracts all the bacteria. Are we together? In attract. Are we together? That's how utaisikia wounds are being managed with honey. Yes, my research in bachelor's was about honey and using it to manage wounds. And you see, honey, their property is to draw it to itself. Are we together? Because of the high sugar level, draw bacteria from the wound. Are we together? So bacteria feed so much on what? On sugar. Now that's just about bacteria. When you talk about cancer cells, their basic food is on glucose. Are we together? So if I am to manage or starve cancer cells, what do? You do what? You inhibit ration. Are we together? Tuko pamoja? Bacteria yenye unakula. By the way, I went to the hospital one day, and there was this. So I had known about the glucose and cancer. And you see, patients are being taken to chemo, right? When they're being taken to chemo, they're given food. Are we together? Because it's exhausting as well. Now when they're given food, utaona wanaletewa hapo mkate, inakutanisha na kasubuki na nini. Are we together? And they have to eat because, well, they need to feed. But then, not knowing that they are very feeding the same thing, they are trying to destroy. Are we together? Now, cancer feeds on glucose. So even when you go to the sanitarium, you may not talk so much about how we manage that specifically. But if you go to the sanitarium, for the first few months, as we manage cancer, our sole objective is to remove, or rather to starve the what? The cancer cell. We starve it. And actually the cancer cells is just start by themselves to do what? To shrink. If it was an open wound, utaanza kuona single cells zinaanza kufanya nini? Kunja. Because hakuna food inapata in that area. Are we together? There's nothing it is feeding on. So when you don't feed it, what happens is they just stop growing. Are we together? And that's what you talk about sugar. Now, also yeast is what should be exempted. Are we together? Yeast. Now, yeast is sourced from where? It can be in bread. Bread. Yeah, it can be in bread, it can be in mushrooms, or even soy sauces. They usually have yeast. So they need to be exempted as long as they're managing a cancer patient. Are we together? Now, old food as well should not be taken. Old food in Yemela. Maybe I was to tell you something. Hizo chako mnapikanga on Friday. Bado ziko hadi fire asubuhi. Eh? Ziko? Uko sure? What I'm telling you is, pika chako Friday, ya kukula Saturday. Make sure to do what? Make sure to finish. Sawa. Tuko pamoja? Kama church mnakula lunch, hiyo asubuhi make sure upe majirani nini? Chapati ulibaki? Usiache until it lasts beyond 6 hours. Are we together? People usually say they can last beyond 6 hours, but I don't advise that. Yeast usually build up. Are we together? It's like rice. Rice kwanza usiache hata ilale usiku. Cook rice which you can finish at a go. Are we together? Cook that rice, make sure to eat it at that time. Iishe. Usiache hata ndio kule the next day. So that's it about that. Starving the cancer cells. Now, let's talk about killing them. Let's talk about killing the cancer cells. I'm giving you the principles. Now, directly killing the cancer cells involves, one, modifying the environment. Number one is doing what? Modifying the what? The environment. Are we together? Now, there's a principle I want to tell you. One principle about cancer cells. Cancer cells thrive in acidic environment. In acidic what? They thrive in what we call anaerobic environment. Are we together? So cancer cells thrive in where we call anaerobic environment, wherever there is no oxygen. So the more oxygen that can come in, it can actually make them do what? It makes them what? Die. Are we together? oxygen kills them. So access to oxygen to cancer cells is like access to their poison. Are we together? So modifying the environment, number one, is making the environment alkaline. Making the environment what? Alkaline. Are we together? Making the environment alkaline. I can split on how to make the environment alkaline, but I can tell you maybe two. Number one is good access to oxygen. Good access to what? To oxygen. Are we together? Oxygen usually inanidini to alkalinity. Are we together? While carbon dioxide on the other end leads to acidity. So wherever there is surplus of oxygen, then there is surplus of alkalinity. And alkalinity is like toxic to cancer cells. Are we together? Understood? Number two, in terms of modifying the environment and making it alkaline, there is something known as sodium mica. Have you heard of sodium mica? Unajua hii kitu tunatumianga okay. I hope it's not you guys. Tunatumianga kuunda mandazi. Inaitwa nini? Baking powder, si ndio? Si sodium bicarbonate. Si ndio? It is not good. Are we together? Well, in mandazi but you can use it to manage cancer. Are we together? People usually get into baths. You've studied about hydrotherapy? Maybe you'll learn that later. But hydrotherapy can talk about us getting into a bath which has sodium bicarbonate. Are we together? Or has something known as Epsom salt. Have you ever heard of Epsom salt? Just care about Epsom salt. So you can get into a bathtub yenye imewekwa sodium bicarbonate na pia Epsom salt. Are we together? And some other essential oils. So that you can use to make the body alkaline. Are we together? Tuko pamoja? You can make the body alkaline. That is modifying the environment. The last thing about making the body alkaline, which I can mention, is this. Detox. Are we together? Detox. Detox is one of the main ways of clearing the body of toxins. Are we together? And toxins make environment acidic. So when you clear the environment of toxins by doing detoxification, which occurs in several ways, including fasting, then you are giving the body an alkaline environment. Are we together? Now, lastly, we have what we call herbs, which you can use to manage cancer. I just mentioned a few of them, but herbs are so specific to what cancer you're managing. Are we together? Now, there are some of the most common ones that we usually use them. Number one is garlic. You know garlic? The normal garlic. Are we together? That is one of the primary herbs that are used to manage cancer. We also have what we call olive leaf extract. Olive leaf extract. That's another herb that is used to manage cancer. We have what we call oregano oil. What we call oregano oil. And lastly, we have what we call grapefruit extract. Grapefruit seed extract. Okay, so there are things maybe I've left out, but those are just the main ones. Are we together? I'm just going to borrow you one of the programs we're using to manage cancer in the sanitarium. Is a program. Are we together? Now these are for the first month. Are we together? These are the program. Now follow keenly and see and how you can apply those ones. Catch which you can. Are we together? Now, so at 6 a.m. they wake up for a cleanser. Are we together? They wake up for a cleanser. So these are body cleansers. Are you following? So they wake up in the morning and then they do a body cleanse. Body cleanse occurs in several ways, including enema. We have what you call at 6:30 they do breakfast. At 8 a.m. we give them what we call multivitamins. Are we together? Remember, I told you we are starving the bacteria. Normally these people don't even feed. Are we following? Wanatumianga tu vegetable salad. Actually, fruit salad is not even there. Then all my food is vegetable salad and green teas. Are you following? So this is what happens. They're given multivitamins.